Hello everyone, my name is Harshit Bardoliwala. I am second year student of Penza State Medical University, Russia. I am here to talk about impact of COVID-19 on student memory process. Relevance. Memory complaint resulting from COVID-19 may have a significant impact on the survivors of quality life. Therefore, research was to determine the prevalence of memory complaint in post-COVID patients. Memory complaint were prevalent in 19.2% post-COVID patient. Individual analysis revealed that treatment of modalities and steroids and antibiotics were associated with the impaired memory. Purpose of my work is how COVID-19 effect on long-term memory and getting insightful knowledge about neural synaptic mechanism of long-term memory and to study memory process of students after COVID infection and to compare the result of our study with the result of other research paper and literature data. Materials and method. We studied more than 45 plus literature sources published in the period of 2016 to 2023 and we studied ability to direct and indirect memorization in medical students. Students were grouped in the four groups. First, second group, each group are 20 people and who had a COVID. We include both Russian and foreign students. And third and fourth group, each who didn't have a COVID. The results were processed using standard computer programs like Microsoft Excel, XP, and Statistics 6.0. Mechanism of long-term memory. Long-term memory formation requires dynamic changes in gene expression and protein translation in neurons. While we have a strong evidence for a critical role of de novo protein, focus on established role of ubiquitin proteasome and mediated protein degradation in LTM formation and storage in the brain. Post-COVID-19 memory complaints. First, dementia. COVID-19 people who have a dementia, the new study led by a research at a Case Western Reserve University data was collected part of the IBM Watson Health Explorer database and data set more than 1 million patients with dementia and 15,770 had a COVID-19 and 810 had a both. The study found that people with dementia were twice as likely to get COVID-19 compared with people without dementia. The research also found that vascular dementia, which is caused by damage to the vessel supply to the brain, lead to highest risk of COVID-19. Second, brain fog. Brain fog in post-acute sequel of COVID-19 infection. It is problematic in remembering, concentrating, and performing daily tasks. In addition, there is a growing concern about long-term COVID where people suffer continuous symptoms for a month after infection. These include hippocampal distribution of microglial activation, hippocampal atrophy, hypoxia, and vascular injury. The outline of these abnormalities combined with laboratory neuroimaging, electroencephalographic, and neuropsychological data implies that brain fog may be driven by direct and indirect injury due to neural networks in patients with post-acute sequel of SARS-CoV-2 infection. Alzheimer's disease. In infection etiology of Alzheimer's disease has been postulated for a decades. SARS-CoV-2 viral infection associated with the Alzheimer's disease. We saw that people COVID-19 have a with COVID-19 were at significantly increased risk for new diagnosis of Alzheimer's disease within 360 days after initial COVID, and mostly people who are elder and in women. Possible mechanism through which COVID-19 can initiate Alzheimer's disease. This includes systemic inflammation, hyperactivation, renin-angiotensin, and renin-angiotensin receptor may be risk factor for COVID-19 patient with Alzheimer's disease. And when entering in the central nervous system, SARS-CoV-2 virus can directly activate glial cell-mediated immune response, which turn lead to accumulation of beta amyloid and the subsequent of onset or progression of current Alzheimer's disease. We show chart of memorization coefficient. We studied on the fourth group as we told. We include foreign and Russian students. First two group have a COVID and third fourth group who didn't have a COVID. We found that in research, students who recovered from COVID, the ability to direct memorization decreased up to 40% both in Russian and foreign students, with compared to who didn't get any ability to mediated memorization decreased by 15%. Memory loss can be a serious condition including in long COVID. After acute COVID-19 infection, 7 and 10% patients continue to suffer from months to cognitive with cognitive symptoms such as brain fog and memory loss. More than 5,400 participants took part in the study of brain fog between 8 December 2020 to 5 July 2021, with 68.6% responded never having the COVID-19 and 31.4 having had the disease. Conclusion: we conclude that now one-fifth of the COVID-19 patients suffer from various degree of memory complaint within a year. Memory impairment is a prominent symptom of COVID-19 and is likely associated with the COVID-19 brain dysfunction. It was clear that analysis that there was a significant reduction in memory scores in all COVID-19 groups. Memory problems associated with the dementia might make it difficult in COVID-19. Patients of either race with dementia were almost 4 times more likely to die from COVID-19 than patients without dementia. References. Thank you for your attention.